Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Seema Pattni. She's a physician coach. Today's Kevin MD article is Why Racism in Healthcare is Still an Emergency. Seema, welcome to the show.
Thank you so much for having me, Kevin. It's really great to be here.
All right. Well, thank you so much for writing and for joining me. So, tell us a little bit about yourself briefly, and then talk about the Kevin MD article that you contributed.
Sure, brilliant. Thank you. So I'm Seema. First and foremost, I'm a mum. I'm also a physician. I've worked all around the world. I've worked as a family doctor. I've worked in hospitals, and I pivoted more recently into working as a coach for physicians. I and writing and speaking that kind of comes around that. And I did this because through my personal journey as a physician and through seeing my colleagues, my friends, everyone around us, I could just see there's such an acute need for this. And I realized that there's so many of us who feel just worn out, burnt out, unrefreshed, and actually just kind of just going through the motions and not really reflecting about what we really want, what's important to us. So I set up and moved into that. And as part of that, I focus a lot on the most powerful experiences that I've had as a physician, including the patients that I've met
Yeah.
and the things that stood out to me about them. Because, you know, it is a privilege, and people tell you the things that are closest to them when you're working with them as their doctor. And I guess a lot of that grew into the article that I submitted to you.
All right. And before we talk about that article, I understand that you are in the United Kingdom in London. So
I
we talk
am.
a lot about burnout here stateside, but I'm going to assume since you're a physician coach in the United Kingdom that burnout and some of the stressors that affect the medical profession is also pretty prevalent there, right?
It is absolutely. And I think sometimes it's a bit tricky using the word burnout because sometimes it's like one of those words that's overused, but it's
Yeah.
really critical that we understand the traumas of being a physician. That doesn't take away from the rewards of it, but you know, they're in parallel here and we see so much. We file it away, but there's not enough support for us. And yes, burnout is prevalent here and it's leading to really extreme things, right? So the suicide rate, to take the most extreme, you know, version of burnout is 24% higher than the national average in the UK. I've read that it's not dissimilar in the UK, in India, etc., but it's phenomenal. And we're losing a physician to suicide every 3 weeks. I don't know what it's going to take, how many lives need to be lost for this to be looked straight on directly in the face for things to change. So yes, that's obviously one end of the spectrum. There's a lot of stages that we have before that, and it's multifactorial. I accept that. But there is something severely wrong when that's happening. And we can't just be like, oh, but that's part of the territory,
Hmm.
right? That's not right. Or be more resilient. I find that narrative very toxic because we are resilient. Doctors have carried the healthcare system on their shoulders for decades, and that's why it's surviving on our goodwill, on our dedication. But, you know, something really big needs to change. And that's why I try and break it down into all the different issues that we're facing and look at those in detail. Things like discrimination, not just the patient's experience, but that we experience, sexism, racism, you know, when female doctors are pregnant, what are the things that we're up against? And all of this, it all builds up, right? And it all contributes to this crisis. So yes, it's massive in the UK. I think it's a global phenomenon.
And one of the things that you said earlier was that the stories that clinicians see really has a and profound impact
Yeah,
on them as
yeah,
well. So you
yeah.
shared one particularly poignant story, of course, in your Kevin MD article. Now, for those who didn't get a chance to read it, tell us about it.
So this is about a boy who I met when I was working in pediatrics. He was in with an asthma attack. He was about 8 years old. And I was just making conversation and I look back and I think, what was the point of that question? But I asked him what he wanted to be when he was older. And nothing would have ever prepared me for him saying he wanted to be white.
Mm.
And when he said that, I just, I didn't know how to respond. There was so much going through my head. And it's only now, years later, that I reflect on that in the article. And I think there's so much here that we need to explore and we need to address. You know, why is an 8-year-old saying this to
Mm.
us? And what is the thinking behind it? But actually, you know, I can now take it further than that and look at the data behind it, the evidence behind it, and look at the inequalities that people who aren't white, what they face. And it's none of it is acceptable, but why is it still here now? It's embedded in centuries of societal structure and hierarchy.
Yeah.
We all know that. We all know what I'm talking about. But it's about how do we start to dismantle that in healthcare? Because if we don't, it's just going to carry on and it's going to get worse, right? And I
Yeah.
think politically now, this is especially important in the US and again in the UK and Europe, the wider world.
Yeah. Yeah.
But from, you know, I'm not in the US, but from what I'm reading and what I'm seeing, this is even more critical than ever before.
So when that 8-year-old patient said that he wanted to be white, tell us some of the thoughts that were going through your mind during that encounter.
I mean, firstly, I was really sad
Yeah. Yeah.
because he's really young. I mean, he's not super young, but he's so young and he's already seeing his identity as a negative thing.
Mm.
And how must that feel to feel like that and to be growing up with that thought? And it's true because I put in the article, I wonder what he thinks now and what he's doing now and how that has shaped him growing up with that awareness. Because actually, he's not wrong in terms of acknowledging the disadvantages that he's at. It's a brutal acknowledgement to have at the age of 8, but he's not wrong either. And that made me even more sad and angry, really. So I think sadness and anger, but also a drive to change it as well, are the things that kind of surface straight up.
So before we talk about some of the drive to change some of the potential solutions, talk to us about some of the scope because after this encounter, it inspired you to dig into some of the data regarding the disparities that a lot of our patients face. So tell us about some of those data that really
Yeah,
highlight those
so
disparities.
I mean, the numbers are more in the article, I think, but essentially, people who are from ethnic minorities face inequality, particularly in maternal healthcare,
Hmm.
in women's healthcare. So the outcomes are poorer. And this means that there's more maternal death, unfortunately. It means that the outcomes of neonates is worse. And this isn't unique just to the UK, it's global. It also actually is across the board from, so we're starting at the beginning there at birth, but it follows you all the way through your life. It's like it almost holds your hand through
Yeah.
your life care, through your life journey. And so things like asthma outcomes are worse, and that's what this little boy was in for. Things like mental health, the crises, the severity that you will experience, that's worse as well. And it's not all down to genetics. It's
Mm.
not all down to, you know, the families that we're growing up in. It's to do with how we're treated, it's to do with how it's recognized, and also to do with how we're educated about it as physicians. There's a real lack of this being kind of processed as a medical student. You know, I didn't have it in my
Mm.
medical education. Okay, that was a couple of decades ago, but when I speak to students of today, it's it's minimal, and I understand there's a lot that medical schools have to fit in. You don't want to be examining every single thing either, but if we don't have these issues integrated into the curriculum, then it's never going to go,
Yeah.
and the biases are going to continue and the issues are going to continue. All these barriers, they have to be tackled right from the foundation. There's no point coming up with surface level ideas to treat it all.
One of the things that you mentioned in your article was an underrepresentation of ethnic minorities in leadership roles, and sometimes
Yeah.
that helps
Yeah.
prevent systemic change. So, talk
Mhm.
more about that facet.
Yeah, well, certainly in the UK, we have the NHS, and the executive kind of tier is often referred to as snowy white peaks,
Hmm.
because that's what it looks like. So you
Mm,
can get to a certain level. There's thousands, hundreds of doctors, physicians who are from every walk of life. But as you get further up the pyramid, that shrinks.
yeah,
And I would find it very hard to believe that it's because none of us are good enough. We are. And in fact, we're more than good enough. Many of us are overqualified. There's that old adage that you have to work twice as hard
yeah, yeah,
if you come from a certain background. So that's severely lacking. But the thing is, there's no point just having representation for the sake of it either, or just to look good and
yeah,
to front a poster. It needs to be meaningful. And actually, the people in those positions need to actually believe in the cause as well, because there's plenty of examples, certainly here, where you have people in really powerful positions, but they don't actually care about the same things. They don't care
yeah.
about what we think they should be caring about. So it's meaningful representation. And then those people having the capacity to make change rather than being constantly up against brick walls that aren't
Yeah.
listening. And again, that's why you need more diversity, because otherwise it's still going to get pushed under in terms of priorities, because people need to be receptive to it. So there's no point having us as a minority. And the numbers don't reflect the numbers of physicians. Does that make sense? So the
Yeah.
proportion of representation, yes, it's getting better, but it still doesn't reflect how many are in the broader workforce of all healthcare professionals, right? So it's still disproportionate.
One of the things you mentioned earlier that resonated with me is that we need different ways or better ways to train in medical school and medical education. And you said beyond superficial changes. So tell us, in your ideal world, what would you like to see instituted to help address some of these racial biases in medical education that goes beyond the superficial?
Yeah, I think, what I'm seeing at the moment is a few modules that are unassessed, therefore poorly attended, and with very little engagement. What I would like to see is actually in every lecture, in every module, in every talk that is given, we have discussion on how are we framing this in the world? So if we're going to be talking about cardio, okay, where are the inequalities here in terms of different ethnicities, in
Yeah.
terms of whether you're female or you're a man, or what social background you come from? What are we actually seeing, as well as going through anatomy and physiology and chemistry? I want to know that as well. And I want that to be just integrated into the teaching. It doesn't need to be a separate module
Hmm.
that's poorly attended. It just needs to be normalized as part of lecture structure. That's what I would suggest, because all of these kind of add-ons, they become then, it almost makes the issue an add-on and not an essential. And, imagine if every lecture you had, that just became one of the points of discussion, because that is how important it is, and that's how prevalent it is.
Yeah.
And things like, it is getting better, but again, it's being steered by independent organizations and not necessarily medical education. But it's about having representation from
Hmm.
patients with lived
Yeah.
experience as well. And things like dermatology, how many textbooks are showing a range of skin types? So, yes, that is getting better, but it's being pioneered by students, which is
Hmm.
great. That's often where a lot of activism begins. But it's now time for it to be properly pushed through.
Sure. So now, after having this discussion and writing on Kevin MD, and of course doing a lot of this research since that encounter, if you were to replay that encounter with that young boy, knowing what you know now and knowing the data, is there anything that you would say or do differently with him?
That's a really tough question. It's hard because he was only 8. I mean, I definitely wouldn't just move on to the next point, which is unfortunately and regrettably what I did. I think I would acknowledge him and probably ask him to tell me why he thinks that,
Yeah.
and what's led him to that, and what does he think would be different if he was white from his point of view. And I think I would want to validate him somehow. I don't know right off the top of my head how I would do that,
Mhm.
if I'm being honest. But I would want him to feel heard.
We're talking to Seema Pattni. She's a physician coach. Today's Kevin MD article is Why Racism in Healthcare is Still an Emergency. Seema, let's end with some take home messages that you want to leave with the Kevin MD audience.
I think that what I have learned over the years is that medicine isn't exempt to all the flaws in society. This medical world is sometimes put on a bit of a pedestal, and people think everyone's amazing and everyone's perfect, but it suffers the same systemic barriers that we see in wider society. But it doesn't mean we can't overcome them. It doesn't mean that there's no other way. And you can find support. It's not necessarily mainstream or really readily available, but there are people out there that can support each other. And sometimes, you go through medicine feeling like it's all you and everything's wrong with you, and that's not actually always the case. Of course, we all have examples of things where we can do better, of course, but a lot of the time we don't get to recognize how much of it is systemic barriers. And so I think I would want people to know that there is support there, and there are people who will root for you through all of this. And also to just keep that hope, because it will drive a lot of what you do, no matter how much you practice medicine for, to keep that hope. And just to remember that, you know, these experiences that we have with patients as physicians, they really do give you so much insight into life, don't they?
Yeah.
And how other people are experiencing things. And there's a real humility in that that I definitely found a privilege, to be honest.
Seema, thank you so much for sharing your story, time, and perspective. And thanks again for coming on the show.
Thank you for having me.